Hi, I'm AJ Chen, founder and principal investigator of the ELHS Institute. Together with my co-pilot ChatGPT, we're going to introduce our innovative GenAI-ELHS solution for monitoring cancer care quality. Let me first share some exciting news. Our solution has just won a prize in a recent global competition sponsored by the Robert Wood Johnson Foundation, RWJF, the leading philanthropy focused on health equity, and Academy Health, the premier health science society. The Transforming Cancer Navigation with Open Data and APIs Challenge, hosted on the HeroX platform, aims to inspire data enthusiasts and tech innovators to develop cutting-edge solutions that improve the cancer patient navigation experience. Cancer navigation is the process of guiding patients through the healthcare system to ensure they receive timely diagnosis and appropriate treatment. Patient navigators have 4 key responsibilities: screening for social needs, monitoring care quality, scheduling appointments, and connecting patients to available services. The navigator role can be performed by an individual or a clinical team. Although navigators play critical roles in cancer prevention and care, the complexity and importance of their work are often overlooked. ChatGPT, what challenges do navigators face when monitoring cancer care quality?
Hi, I'm OpenAI's ChatGPT. Navigators often have limited medical training. One of their biggest challenges in quality monitoring is the lack of powerful AI tools. Without adequate, standardized AI diagnostic tools, navigators cannot effectively identify care gaps in diagnosis or treatment across all cancer types. Even when care gaps are found, navigators often aren't trained to suggest actionable next steps to help patients make informed decisions with their doctors. This may delay timely diagnosis and personalized treatment. Fortunately, general-purpose generative AI based on large language models, LLMs, has shown great promise in supporting a wide range of healthcare tasks. This creates hope for the development of broad-spectrum AI diagnostic tools to empower navigators. What does your published LLM benchmarking study show?
Partnering with professors at Stanford University, we published a benchmarking study in JAMA showing that LLMs can achieve unprecedented accuracy in disease prediction. In another study published by JAMA Network Open, we demonstrated that GenAI chatbots can serve as co-pilots for doctors and navigators. That's the good news. However, we also identified a major bottleneck. Most clinical teams or navigators don't have access to LLMs that meet responsible AI requirements. These tough requirements include: 1. Equitable access to high-accuracy, low-cost LLMs under the control of clinical teams to ensure patient privacy and data security. 2. Elimination of data biases in LLMs for the patient populations they serve. 3. Availability of preclinical validation data for evaluating LLMs' readiness in clinical care.
You're right, this bottleneck must be removed. Fortunately, your strategy looks promising. Your research uses open health data to generate synthetic patient records for fine-tuning smaller llama models, achieving high prediction accuracy at low cost. The fine-tuned LLMs can then be integrated into agentic workflows capable of predicting a wide range of diseases. These technological breakthroughs enable you to design a GenAI-first navigation solution that any navigator can use to monitor and improve cancer care quality. AJ, tell us more about your award-winning GenAI-ELHS solution for the RWJF-sponsored Global Challenge.
To maximize impact, we've designed our solution to support both web-based and clinical environments. On the web, we've deployed healthcare navigation services via our ELHS GenAI platform, allowing navigators and patients to compare actual care with high-standard care predicted by GenAI. This helps identify care gaps and suggest actionable steps for shared decision-making with clinicians. We can also implement our low-cost GenAI-ELHS navigation solution for any clinical teams worldwide, particularly those in low-resource community or rural clinics. When patient cases become available in clinical settings, the system can automatically predict diseases and recommend diagnostic tests, enabling navigators to monitor care quality and ensure that patients receive equitable, timely, and high-quality cancer care throughout their patient journey.
Since your solution uses synthetic patient data, it has an added advantage. It enables easy onboarding and learning of the navigation workflow to support early diagnosis and personalized care. As demonstrated on the ELHS platform, a new patient chooses a navigator first. After each visit, the patient enters their health records. In future versions, patients will be able to authorize the system to automatically pull records from hospital EHRs. On the navigator screen, one navigator can assist a large number of patients. For each patient, the navigator composes a case using available records and uses the ELHS GenAI agent to generate predictions, such as differential diagnosis, confirmatory tests, and guideline-based treatment options. Based on these predictions, the navigator may identify potential care quality gaps and make comments on the next steps. As a result, the patient can see a side-by-side comparison of his/her actual care versus GenAI predicted high standards of care, along with the navigator's guidance. This care comparison information, personalized at individual patient level, was previously difficult to obtain for ordinary patients. Now becoming readily available in GenAI-ELHS, it will undoubtedly enable the patient to engage more proactively with their doctors to improve patient care.
For example, a 62-year-old male patient had an elevated PSA level. AI predicted a risk of prostate cancer, but it was already too late. Given his family history of cancer, navigators with GenAI should have recommended PSA plus DRE screening much earlier, which may detect the cancer at an early stage. Another case involved a 66-year-old female patient. The AI prediction of pancreatic cancer risk should have allowed navigators to provide timely patient education and encourage the patient for early diagnosis and treatment. Genetic counseling should have been recommended due to her family cancer history. More examples of typical cancer cases are available on our navigation benefits page.
These synthetic patient cases are powerful demonstrations for both patients and navigators. Because they are synthetic, they can be freely shared without any privacy concerns. Additionally, the web-based navigation system can be used to train navigators before and after the GenAI-ELHS solution is deployed in clinics. This accessible training model will help accelerate the adoption of GenAI-enabled navigation tools by healthcare providers. There's one final question. How effective is this system in actually improving patient outcomes?
Great point. We can't assume that GenAI-enabled quality monitoring will automatically improve outcomes. We need strong evidence and mechanisms to ensure success. That's why our innovation goes beyond GenAI technology alone. We're building Equitable Learning Health Systems, ELHS, powered by GenAI. The most impactful innovation is our system-level approach to integrate GenAI into ELHS units. As described in our Nature Scientific Reports paper, we introduced the first simulated ELHS unit. Our web-based navigation system functions as an ELHS unit, and the clinic version will also be deployed in partnering clinics and hospitals. These units embed comparative effectiveness research using real-world data. While delivering navigation services, ELHS units continuously learn and evolve. Any clinical team can generate real-world evidence and new knowledge on GenAI's impact in clinical care, helping navigators monitor care quality and improve patient outcomes at scale.
What a novel and practical concept. By realizing the learning health system vision of the U.S. National Academy of Medicine, your ELHS units have the potential to drive large-scale improvements in cancer outcomes across all populations.
In closing, we are proud that the GenAI-ELHS solution was selected as a winner in this global challenge. This recognition highlights the power of GenAI to empower patients, navigators, and doctors in improving the quality of cancer care. Building on this momentum, we are launching free training programs for clinical teams to integrate responsible LLM-based GenAI into cancer care and research, and to publish real-world evidence of GenAI transforming healthcare. Please note that the GenAI-ELHS solution can also be applied to disease areas beyond cancer. Thank you for watching. See you next time.